Sorry, everyone. We had a problem with the mic here, but as I was trying to say, every day it seems like we've got more and more to report to you. Today, I'm going to lead off by saying that I am now signing an executive order that suspends all elective medical procedures. This is being done to conserve our personal protection equipment for our frontline healthcare workers that are battling this terrible virus. It goes into effect at midnight tonight, or 11:59 tonight. So all elective surgeries will be off the bubbles as of tonight, and that's what the executive order is. Also today, I am issuing an executive order to shut down all private campgrounds to all new arrivals by out-of-state residents. And what I mean by that is just this. If you're now residing and living in a campground, you're good to go, a private campground. If you've been there in excess of over 2 weeks and you've quarantined yourself or whatever, if you've been there and everything, we're good to go there. No problem with either one. But if you're in a private campground that is a new arrival from an out-of-state destination or whatever, we're shut down to you. And we're doing it again in an effort to try to protect us as West Virginians from someone coming in from another state and basically contaminating or infecting thousands. That's all there is to it. We're really moving in the right way here. All the statistics show just that. Yesterday, we went through with about a 3.8 or 9%, positive versus the number of tests taken. That's tremendous. We've been trending about 4%, and if we can stay there, we're going to be in great shape. The nation is trending at 8 to 10%. And New York City is trending at 30 to 50%. It's unbelievable. The thing we have all got to realize and go over in our minds over and over and over, this is a terrible inconvenience. I get it, but we've been really good at what we've been doing, and we've got to keep on doing just exactly that. We've been serious about what we're doing, and that's why we keep kicking out this 4%, 3.8% now. Now, the nation is kicking out 8 to 10%, and some way, somehow, they're hanging on, but New York City is kicking out at 30 to 50%. That means that of those people that are checked, and there's thousands getting checked, of those people that are getting checked, nearly half of them are testing positive. If that were to happen here, our hospitals would be overrun and we would be in a catastrophic situation. It can happen here because we are the highest risk state in the nation, but yet we're trending and doing all the right things at this time. We need you. We need you so bad to keep up what we're doing. Stay the course. This will pass. And then we'll all feel wonderful about it. We've already lost one too many lives, period. We've lost one person, and that's one too many. And let's pray in every way, shape, form, or fashion that we won't lose another. Now, I've got a couple other announcements that I'll do really quickly, and that is just this. We've got another situation that is a critical, precious commodity to the state of West Virginia, and that's the Williamson Hospital. In Williamson is in a county that it is the only hospital, Mingo County, and we've got to absolutely, try to keep that hospital open. Now, there's private negotiations going on right now between two parties, but I want everyone to know that I stand ready at the state, and we're working that. I stand ready to try to help in any and every way we possibly can, because we've pulled it off with Fairmont to be able to give them some kind of level of life in our seventh largest city in our state. and we need to pull it off with the Williamson Hospital. We got too many people that are employed. We got an area of our state that desperately needs that community hospital, and I would try to work in every way possible that I can work to see that we keep that hospital open. Last thing I'd tell you, and they're all important, it seems like this is a little bit insignificant, but it's not. Back before this all happened, I told you about the census, and we put a whole lot more people to work. And the census actually counts the number of us that are here. And for those that don't get counted in the last go round, a lot of us did not get counted. And for those that don't get counted, it really hurts because federal dollars in so many different ways can flow to us. So absolutely, if you've not gotten a little card, in the mail, then look at our screen right now and respond to that number. Because you should have already received that little card. And as you get that little card, please respond to it and be counted. And that will prevent people from having to come to your house and try to count you. But literally, please get counted in this census deal. Well, that's really all I've got right now. And every day it seems like it's a lot of stuff. If you think, signing an executive order to stop elective surgeries in this state isn't a big deal, it's a big deal. And if you think really and truly that shutting down our campgrounds to our private campgrounds isn't a big deal, it's a big deal. And so everything from our Williamson Hospital to all the different things we're doing, but I remind you just one thing, and I'll end with this. Whatever we're doing is working. Run the play. Run the play. Just keep running the play. Let's stay at 4%. Let's stay at as the minimal amount of deaths that we can possibly stay at, because one that we have right now is too many. Anyway, I'll turn it over to your questions now, or we'll go on.
Thank you, Governor. Ladies and gentlemen, as part of our briefing today, our friends with the media are once again joining us by teleconference. We'll take their questions in just a moment, but first we're going to take comments from a few of our panel members. Up first, Dr. Clay Marsh, our coronavirus czar.
Well, thank you, and it's good to be with everybody. I'm going to limit my comments as well because we talked a lot yesterday, but I would just say that we are seeing around the country that metropolitan areas of the United States are starting to see the same surge that New York City saw. And what the governor has said and the moves that have been made to help people stay at home and stay separated and reduce the spread of this virus is really, really important. And we've seen great benefit from the work that we've done so far. And this is all of us. Each one of us needs to take responsibility, not only for ourselves, but for our communities, for our state's health, and also for the healthcare workers' good keeping. Because we know that when we have so many people that spread the virus rapidly, that starts to overwhelm the healthcare system to be able to operate well. And I wanted to also thank our medical centers, our universities, our hospitals, our long-term care owners and leaders, because everybody is really coming together in the state, and we are focusing on creating a single entity in the way that we are working, communicating. There's nobody who's competing against each other. We are all part of West Virginia. We are here to try to make sure that we protect our citizens, as the governor said, try to reduce the number of people that die of the COVID virus infection to an absolute minimum, but also to make sure that we are providing safety for our essential workers, for our first-line medical care providers, for our first responders, our police, firefighters, people, EMTs, and even people that are working in the essential industries, doing the work that is helping us keep our places clean, help keep our shelves stocked with the groceries and the food that we need, and the different resources. So this is absolutely a team effort. And to that level, it's very inspiring for me. But as the governor said, it's easy to become complacent, and we want to make sure that every day we wake up and we stay just as committed as we have been to date to try to protect the state of West Virginia. And currently, I think people are doing an amazing job. So my thanks. Those are my comments.
Thank you, Dr. Marsh. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Today we have 370 guardsmen on duty. Our stabilization efforts for our feeding programs continue to be effective and go well. Under logistics support, we did receive a shipment today from the national stockpile. That is being broken down and will be distributed tonight and in the morning. In addition to that, the information related to the specifics of this will be in the National Guard press release at the end of the day. Our efforts in supporting Dr. Marsh and Dr. Schlemp with the data analytics continues to move forward, as does our efforts to provide support to the epidemiology teams. I would leave you with this on behalf of the members of the National Guard. As Dr. Marsh said, our first responders, our healthcare workers, those essential workers out in the field today, we ask you to please voluntarily follow the guidelines as directed by the governor, so that we can continue to keep our curve flattened and continue to do the things we need to do to keep West Virginians safe. Thank you.
Thank you, General Hoyer. Up next, we'll go to Secretary Bill Crouch with the West Virginia DHHR and Dr. Kathy Schlemp, our State Health Officer.
Hello, everyone. I have a couple of things that I'd like to push out to folks. Our Bureau of Children and Families in DHHR has been granted 2 waivers from the federal government for the SNAP program, or the Supplemental Nutrition Assistance Program, as part of the ongoing response to COVID-19. One waiver will provide an extension to the renewal period for those already receiving SNAP benefits. And another waiver will allow for supplemental payments to households approved for SNAP benefits prior to April 1, 2020. One more announcement. Yesterday, we received our emergency Medicaid waiver from CMS. That was turned around in 1 week. We received that Monday, had submitted that the prior Monday to CMS, so we thank them and the administration for that quick turnaround. Bureau of Medical Services has been approved to remove prior authorizations. Therefore, BMS is working with the MCOs in the state. We'll be removing prior authorizations April 1st. In addition, all pre-existing authorizations will be extended. CMS has also granted authority for provision of services in an alternative care setting. And provider enrollment flexibilities have been approved to immediately increase access to expand the provider network. We're streamlining that process and waiving certain provider enrollment requirements. So I want to thank our healthcare workers. Please stay safe. Thank you.
And I'll simply update that we certainly have teams regionally working with local health departments in collaboration and with the National Guard support for doing case and outbreak investigation at the community level. That is moving forward well. Lab-wise, we have got about 185 testing locations are identified across the state. And we've tested probably around 4,000 West Virginians as per the website numbers. So that is moving forward, continue to work to expand that. And then the other thing I just wanted to remind folks of, clearly there are a lot of supports going on. We've been hearing from each of our partners in terms of the types of activities and supports people have available financially and childcare wise and otherwise. I want to remind people that there's a new piece of the coronavirus wv.gov website on behavioral health, which has linkages to finding the behavioral health center in your area. If you would like to link into support services through them, they are all available and do not require insurance to attend or to visit there or to reach out. There's also information about speaking with children and managing the stress in your own lives. So please do use that website and the resources available.
Okay, thank you. Once again, we are holding today's briefing with media members joining us virtually to practice good social distancing. To media members, when we call on you, please remember to unmute the microphone on your end before asking your question. Please confirm your name and affiliation as well. Today, some media members will be asking their questions through video chat. The first questioner today will be Kenny Bass from WCHS.
Hi, this is Kenny Bass with WCHS TV8 and Fox 11. I have a question for Governor Justice. The ACLU of West Virginia has reacted fairly negatively to your statements yesterday on the private park situation and out-of-state residents coming into West Virginia. What would you say to their concerns that what you're doing would be limiting people's constitutional rights?
Well, Kenny, first of all, we want to be really respectful of constitutional rights, but people are dying all over this country, right and left, and it's beyond belief what all of us are trying to deal with. We're dealing with an absolute pandemic, a worldwide pandemic, and people are dying all over the place, and I'm trying to do everything I possibly can to protect our people, and I'm going to do that. I'm going to do that to the fullest extent that I can possibly do it. And from the standpoint of people coming in here from New York or wherever, or New Jersey, Connecticut, Italy, China, wherever they may be coming from, if they don't quarantine themselves for 14 days, you know, I'm going to take a big time issue with it. And I may lose at the end of the day, but I'm going to try to protect our people. And right now, we don't want people coming in here from any state whatsoever, but we especially want the people to know that people coming in here, you know, from New York, New Jersey, Connecticut, we're going to expect them to be quarantined, self-quarantined for 14 days. And if they don't do it and everything, they're going to have a visit real quickly from one of our police officers demanding that they do it. And then if they don't do it, basically they're going to be obstructing justice, and that's a really serious issue with them. And so we're just wanting the people from New York. We love them, and we love the people from New Jersey. We love the people from Connecticut. For crying out loud, you know, one of my best friends growing up in my whole life, Dr. Mike Lucchini and everything. Mike and I played golf. We did everything together. We played basketball, everything. Grew up together, went to high school together, and he's a surgeon in Connecticut and everything. But we can't have Mike here right now. That's all there is to it. And if Mike comes, he's going to have to quarantine himself, and that's just simply that.
Okay. Governor, this is Clay. Can I make one comment briefly?
Absolutely, Clay, please.
So I would also say to that question, we're really trying to fulfill the direction and the guidance from the Centers for Disease Control. You know, there is currently an internal to the United States ban on travel and guidance to New York, New Jersey, and Connecticut. And there is clear guidelines that people that come out of those areas should self-quarantine for 14 days. So in my opinion as well, this is also following the guidance of the health leadership for the safety of our population.
Okay, thank you. Kenny, up next we have David Beard with the Dominion Post.
Hi, this is David Beard, Dominion Post. Mon County has some golf courses that are still open that draw golfers from Pennsylvania, and some of the course owners have asked us how they should respond to these travel orders as far as accepting the out-of-state golfers.
Well, let me lead off by saying just this, and then maybe we can pass this to my general counsel or whatever. But I would discourage, you know, anyone coming in from out of state. You know, from the standpoint of keeping our golf courses open and our outdoor spaces open and everything, you know, that's an issue all to itself. You know, for the people that own the golf course or whatever, we'd encourage if the golf course is open, play golf. As far as people commuting to do essential services that are from out of state, we have people that live out of state across the borders and come every day, and we want them to continue to be able to come. We're just trying as hard as we possibly can to not have someone from an outside state bring an infection here. Maybe they don't even know it, and before you know it, they infect all kinds of people, and it's as simple as that. You know, so Brian, do you have any comment on that, or Clay, or anyone else? But But I really don't know how to answer it other than just this, to try to discourage in every way people coming from our state, from out of state.
Clay might be able to better answer.
Clay, do you want to weigh in on this?
Sure. I'd be happy to make a quick comment. You know, I think the governor is wise from the perspective that the more connection that you have between people, particularly from endemic areas to less endemic areas, the more likely this virus spreads more quickly. And remember, really what we're trying to do here is we're trying to protect each citizen and asking them, importantly, to protect themselves. But what we're trying to do at the public health level is try to reduce the rate of spread of the virus, flatten the curve, reduce the surge so that we're protecting people in the state and protecting our healthcare workers. So trying to make sure, one, that we limit traffic as much as possible. But two, importantly, when people are together and if they are doing outdoor activities or if they're in stores or whatever, we very much want them to stay the social distance away from each other, 6 feet. And we also want to make sure that we are doing the right types of measures to protect ourselves in those kind of settings. So a lot of people have talked about there's crowds in stores, there's crowds, outside in parks, et cetera. And part of the executive order, as I understand it, and Brian can clarify, but it gives each citizen the responsibility to maintain that social distancing and to protect themselves and protect all of us. And if that doesn't work, then even making a call to some of the local authorities just related, not to arrest somebody, but to make sure that we are encouraging in a clear way that this is not only your responsibility for yourself, this is your responsibility for all of us.
Let me jump back in. I'd like to add one other thing, and that's just this, is I want people to really understand. It's always easy to understand me. It takes a little while maybe for me to talk and everything, but we love the people from Pennsylvania, and absolutely we are very respectful from the standpoint that many people, from Pennsylvania are coming into Mon County, and all of that we want to preserve forever. But we just got to understand that from the standpoint of our state, we have a stay-at-home order, and from the standpoint of we know these other states are significantly more infected than we are in West Virginia. And all we're trying to do is protect the most elderly and the most chronically ill populations that any state has. And we're doing it, and so therefore I would significantly discourage, if I were the golf courses, I would significantly discourage people coming today from Pennsylvania. We just had a terrible outbreak in Morgantown, in that area, in Mon County, with a nursing home there. And we're trying to get our arms around it, and we're doing a pretty decent job, but it could have been super, tragic. And so with all that, it's just simply just this. If we have a visitor from Pennsylvania, surely discourage them to stay at a distance from one another, out on the golf course, and then ask them as politely as you can and everything that it would be better for now for you not to visit across the state borders, and we'll all be better off for it.
Okay, thank you, David. Up next, we have Annie Moore from WVVA.
Hey, Annie with WVVA. You mentioned the positive testing results were really good. Recently, Unicast gave West Virginia a C grade on social distancing. Is there any plan to step up enforcement on West Virginians specifically?
I don't think, Annie. I think we're doing a great job. 4% is great. 2% would be better. 0% would surely be better. But we're doing a good job. Our hospitals are able to handle what is going on right now. You know, the reason that we're trying to do away with the elective procedures right now is to be able to preserve the equipment to keep our healthcare workers safe. You know, we're still short on that and everything, but West Virginians need to be really proud of themselves right now. They're doing a good job. And they've got to just stay the course and everything. And police one another as best you possibly can. If you see a big gathering and whatever like that, if you feel uncomfortable with saying something about it, call a local official to come in and help you with that situation and everything. Because that's what we want to do. We want to continue to stay the course. We're doing a great job. And let's just stay at it.
Okay, thank you. Up next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, tomorrow's April 1st. People all around the state are worried about making rent. They've been told that, the federal stimulus checks are on their way, but it could still be several weeks. What would you say to renters and to landlords?
I would say first to the landlords, surely to God above, you can't, impose a hardship on somebody that's trying in every way to make rent today. And our federal government, I think mandated or surely encouraged you not to do that. And as far as the renters, I would say, please take every advantage of this stimulus package. Work it any way and every way you can. We're sending out information. There's information flowing all over your websites and everything. Use those websites to the very best of your ability. And in some way, somehow, weather the storm. Monies are in the pipeline and monies are coming, and you're going to be okay. You'll get through it, and you'll be okay. But use all of our agencies and use all the websites, to see all the dollars that are going to flow your way and when they're going to flow. But as far as the landlords, please, for crying out loud, now's the wrong time to be ugly. Now's the time to be loving, and that's what we need to do.
Okay, thank you, Charles. Up next, we'll go to Dave Mistich with West Virginia Public Broadcasting. Dave, please unmute your mic.
Sorry about that. I think we're good now, right?
Yes, we got you.
Okay, great. So my question is, we're talking about this 4% positive rate here, and 10% nationally, 30 to 50% in New York. My question is, at the rate that we've been testing, if we were to be testing more, is there concern that 4% could be jumping up higher and that we're right now missing a lot of positive cases that might be out there?
I'll let Kathy or Bill answer that, or Clay. That's to the medical community. They know better than I.
So this is Clay. Let me start, and then I'll turn it over to Kathy and Bill. So the reason why we're looking at the data, Dave, the way that we are, is because we're trying to control for the number of people tested. So different states obviously have different capacities to test. But we have very consistently in West Virginia been focused on trying to identify the people we think have either the highest risk of being infected with the COVID virus, or people that have key contacts when we look at epidemiological trace case studies and follow-up, where you have contact with people that are infected, or you've gone to indigenous areas that have higher rates of infection. And because we're expressing this as a percent, we are taking into account differences in the number of people tested. So we're doing it as a proportion of the total number of people tested. We, in many ways, I believe, are biasing our results toward actually having more people that are found positive than some other states. And the reason why is because as we expand our testing and we start to do more surveillance testing, we would expect that a higher percent of people that we're surveilling that have no symptoms, have no real risk factors for developing the COVID virus, that percent would have a lower positivity rate than the very high likelihood sort of focus people that we're testing today. So in many ways, we presume that the 4% actually is a higher number than the total percent of people infected in the state. But importantly, even if that's not a good assumption, what we're looking for is we're looking for the rate of change. Because again, we are interested in making sure that we protect each person and that they have the instructions to protect themselves. But we're really looking on a daily basis and cumulatively for what is that percent of people tested that are positive, because we would expect as the virus starts to compound and take off into that surge kind of path, that we'll start to see those numbers change. And when we look at other states, as the governor suggested, the 8 to 10% is a percentage basis, which takes into account the total number of people tested and the relative part of that population that's positive.
Okay, thank you. We have time for one more question. We'll go to Brad McElhenney with West Virginia Metro News.
Oh, hi, Governor. You mentioned earlier today on Metro News Talk Line that there would be an afternoon meeting between yourself, Attorney General Morrissey, and Secretary of State Warner regarding the election, which is May 12th, which appears to be when West Virginia might be coming on the downside of the peak of the epidemic in the state. So what I wondered is if that meeting has already occurred or if it's up ahead, and what your current thoughts are on the safety of having polling places open.
Well, the meeting has not occurred yet. It's going to occur in about 10 minutes or 5 minutes, and I look forward to that and everything. You know, our Attorney General Patrick Morrissey and our Secretary of State Mike Warner have done a marvelous job. They you know, we all are continuing to stay in contact with one another constantly, and you know, we're going to have a real in-depth discussion, you know, just about what we're going to do as far as the possibility of a suspension or not. You know, from my standpoint, Brad, it's just as simple the way I see it, and it's just this: is I'm still cautiously optimistic about the possibility of getting our kids back in school. And if you believe that is a possibility today, now, if you don't believe it's a possibility, it's a different thing. But if you believe that's a possibility, the last thing that we want to do in the world is expose our children to all these people coming into the polls. And so that's a really gigantic concern, you know, whether it be the poll workers or it be people coming in, you know, to the schools to vote or whatever. There's so many things that we've got to consider here. And moving an election is a really serious thing. And I don't take that lightly in any way. I'd hope so much, you know, from my standpoint, I'd love to see us have the election on time. Love for everybody to come out. Love to be able to facilitate it in some way or another. But the president comes out with moving the date till April the 30th. You don't have a lot of room, and so we're going to discuss it a whole lot more. But that's a 2:45 meeting that I'm going to right as soon as I get through here.
Governor, I'll turn it back to you.
Well, the only thing I would do is recap real quick. First and foremost, you know, I salute all West Virginians, especially our healthcare workers, our first responders, for the great work that they're doing. Stay the course, West Virginia, please. You know, we got to some way, somehow, you know, save the Williamson Hospital, and we've got to be sure that and I'd like for you to put back up on the screen, you know, the cards that you should have received in the mail from the census standpoint, and I'll keep talking until you come up with that, but again, you know, we're holding at nice levels. You know, to recap, two major announcements today. You know, the one as far as shutting down the private campgrounds to out-of-state people that are new arrivals and everything, you know, and so the people that have been there, they're doing great. That's great with me. And the biggest thing of the day is the executive order, you know, suspending all elective procedures. We've got to do that in order to some way take care of our first responders and all of our healthcare people and everything, and try to reel in all the protective equipment and supplies that we are short of right now. And any elective procedure, we're just going to postpone it for a while. But I guess that's about it. I'd like to put that back up on the screen if you could right now, and let me just remind people, you know, from the census standpoint, if you've not received this little card in the mail, then please call this number. Please call the number right now and be counted, because West Virginians are really dependent upon those federal dollars, and the more that we're counted, the more we're going to get. But again, I thank you, and just stay the course. You're doing great, West Virginia. I'm really proud of all of you. Thank you now. Bye-bye.